Sexually transmitted diseases, or STDs, are highly common, with millions of new cases in the United States each year. These infections are typically passed on and contracted through oral and penetrative sexual activities, and rarely, but still possible, through intimate physical contact. Sex isn't the only way to contract an STD. This is just a myth. Like most illnesses, the pathogens take time to incubate in the body and vary in symptoms, so it may be difficult to absolutely be sure you have or do not have an STD unless you get tested. In this video, learn more about the most common STDs, who should undergo STD testing, and how eNational testing can help. Let's first talk about which STDs are likeliest to strike. First, HIV. Human immunodeficiency virus, or HIV, is one of the most debilitating STDs as it impedes the body's ability to protect itself from pathogens and illnesses. It can also escalate into AIDS, acquired immunodeficiency syndrome, which is a life-threatening condition. HIV can take between 2 to 6 weeks to manifest flu-like symptoms, which are often mistaken for a different viral infection. However, this is the period that a person is most infectious, so it's important to get tested as soon as possible. Patients might not exhibit severe or persistent symptoms of HIV for a decade or more after getting infected. These may include headaches, fever, sore throat, swollen lymph glands, fatigue, and rash. As the virus multiplies and attacks immune cells, the patient may develop chronic symptoms like diarrhea, weight loss, and shortness of breath. Late-stage HIV can be characterized by severe night sweats, chills, high fever, persistent diarrhea, and headaches. Second, genital herpes. This STD is contracted when the virus enters the body through mucous membranes or small scratches or breaks in the skin. It often goes undetected at first because the disease can have mild to unnoticeable symptoms, which is part of what makes it so contagious. However, when it becomes noticeable, the first episode of symptoms, also referred to as outbreak, is typically the worst. Patients may experience flu-like symptoms like fever and muscle aches, as well as enlarged lymph nodes in the groin area. Some people don't have a second episode, while others experience recurring episodes for many years. The symptoms of genital herpes include irritated bumps, blisters, or ulcers on the genital regions and surrounding areas, as well as pain or itching in the genital region and inner thighs. These can cause persistent discomfort and pain when urinating. Third, syphilis. Syphilis is a sexually transmitted infection that is caused by a bacteria that primarily targets the genitals, skin, and mucous membranes. However, it can also affect other body parts, including the heart and brain. If untreated, syphilis may spread and cause severe damage to the internal organs and even death. There are 3 stages of syphilis. The primary stage is characterized by a canker sore around the infected area, which is normally the lips, tongue, genitals, or rectum. The secondary stage sees worse symptoms, such as rashes with sores on the body, including the palms and soles of the feet, swollen lymph nodes, persistent fatigue, soreness, and fever. The tertiary stage, or late-stage syphilis, has severe signs including numbness, paralysis, blindness, and dementia. Some of those with syphilis may also be asymptomatic, wherein they test positive for the disease in blood tests without showing any symptoms. Fourth, chlamydia. This bacterial infection affects the genital tract and is difficult to detect in its early stages due to mild or no symptoms. The illness typically manifests a week to 3 weeks from exposure and infection. The signs of chlamydia are particularly uncomfortable, including pain while urinating, pain in the lower abdomen, and genital discharge. Fifth, gonorrhea. This is another type of bacterial sexually transmitted infection that can affect the genitourinary tract, rectum, oral cavity, and conjunctiva of the eyes. Men tend to experience symptoms soon after exposure, whereas women tend to have symptoms after complications of infection have arisen. Then, there are some who experience no symptoms at all. If symptoms do occur, they are very similar to those symptoms experienced with a chlamydia infection. Therefore, when someone is testing for chlamydia, it's recommended to also test for gonorrhea. Women may also experience vaginal bleeding with intercourse or in between menstrual cycles. Sixth, HPV and genital warts. Considered one of the most common STDs, HPV itself does not have symptoms, but some types of HPV or human papillomavirus increase women's risk of developing cervical cancer, while others cause genital warts. These warts appear small and flesh colored or gray, usually clustered together and cause discomfort or pain. Additionally, genital warts can multiply and may also develop in the throat or mouth of an infected person. It's important to remember that many sexually transmitted illnesses do not have visible symptoms. But despite being asymptomatic, those with STDs may still transmit these diseases to their partners. Therefore, it's important to consistently use protection when engaging in sexual activities to reduce the chances of passing on undetected infections. Given that many sexually transmitted diseases do not present visible symptoms, manifest after several weeks, or have symptoms that fade and return over time, testing is the only definitive way to know if a person is infected with an STD. STDs are treatable, and many are even curable, but you need to catch them early on. So, if you have engaged in any sexual contact that might put you at risk of contracting a sexually transmitted illness, you should talk to a qualified medical professional about getting tested. The CDC has particularly recommended STD testing for the following groups. Those between the ages of 13 to 64 are recommended to be tested for HIV at least once in their life. All sexually active women, especially those who have new or multiple sexual partners or a partner who has an STD. All sexually active men, especially those who have same sex intercourse. Those who are pregnant, and all those who engage in sexual behaviors. However, the minimum age for STD testing may vary per state, so it's best to check what's applicable to your area. Additionally, STD testing can be performed during a woman's period. Your cycle shouldn't be a cause of delay for getting tested if there is a risk of contracting an STD. eNational testing offers nationwide STD testing that's simple, discreet, and reliable. To order an STD test from eNational Testing, follow these 3 easy steps. Order your STD test online. Select the laboratory location where you'd like to be tested. eNational has more than 2,700 locations across the country, so choose the site that's most convenient for you. After eNational Testing confirms receipt of your test payment, the lab requisition will be emailed to you within a day. Go to the lab. After receiving your lab requisition, proceed to your chosen laboratory for sample collection. Check your email for the results. eNational Testing typically sends test results via email within 2 to 3 business days. A medical provider may reach out over the phone if you tested positive. Aside from getting tested for individual STDs, eNational also offers 8-panel, 10-panel, and urine STD testing to simultaneously screen for multiple diseases.